Hello everyone, I am Dr. Bharat, consultant surgical oncologist at Fortis Cancer Institute, Bangalore and Precision Oncology Clinic. Today I am going to talk about sentinel lymph node biopsy in breast cancer. Sentinel lymph node biopsy is done for management of early breast cancer. So the treatment for early breast cancer usually involves surgery as one of the modalities of treatment. Surgery for early breast cancer involves removal of the breast lump along with the margin and addressing the lymph nodes, that is the axillary lymph nodes. Historically, the axillary lymph node treatment was by doing an axillary lymph node dissection. The problem of doing an axillary lymph node dissection was that some of these patients used to develop lymphedema, and most of the patients of early breast cancer are long-term survivors, and the lymphedema used to hamper their quality of life. To prevent this, sentinel lymph node biopsy was devised. So sentinel lymph node biopsy is done in early breast cancer where the imaging or any other modality does not reveal any enlarged lymph nodes in the axilla. So what is sentinel lymph node? And how do we do sentinel lymph node biopsy? So we usually inject a dye or a radiotracer around the nipple or around the tumor, and this dye or radiotracer goes to the lymph nodes in the axilla. So the first few lymph nodes to which the dye or the tracer would have gone are removed during surgery, and they are sent to the lab for frozen section. So during surgery, the pathologist will tell us whether the lymph nodes are involved by cancer or not. If they are not involved by cancer, there is no need to remove the rest of the lymph nodes. If they are involved by cancer, then the rest of the lymph nodes have to be removed completely. That is, an axillary lymph node dissection has to be done. So what are the different techniques of doing sentinel lymph node biopsy? Sentinel lymph node biopsy can be done by using dyes like methylene blue, indocyanine green and other dyes. It can also be done with the help of radiotracer molecules, and there are other techniques of doing sentinel lymph node biopsy as well. In our center, our preference is to use methylene blue and indocyanine green for axillary lymph node, sentinel lymph node biopsy. The standard of care is to do dual dye technique for sentinel lymph node biopsy. So usually a combination of either a dye and radiotracer or two dyes are used to do a sentinel lymph node biopsy. So by doing sentinel lymph node biopsy, we are able to avoid the potential complication of lymphedema in majority of the early breast cancer patients, thereby improving their quality of life. Thank you.